Good afternoon. My name is Amanda Scott, and I am the Senior Manager of Meetings at National Quality Forum. For a little over a year, we've hosted these town hall webinars where members have shared real-time experiences navigating the challenges around COVID-19. In today's webinar, we are excited to partner with New Jersey Healthcare Quality Alliance, who will share their action plan for emerging from COVID-19. This program is made possible by you, the members of the National Quality Forum. Members are the driving force behind NQF's mission to advance measurable health improvements. Together, we do the work that enhances healthcare value, makes patient care safer, and results in better outcomes. Members continually demonstrate their shared commitment to the NQF mission through engagement and service, and our presenters today are no exception. Before we get started, I would like to go over just a few logistics. We hope you'll take an active role in the question and answer portion of the program using the Q&A box at the bottom of your screen. However, please help us stay on topic and refrain from any questions or comments that aren't related to the information being shared today. We have muted all lines to ensure that unexpected noise does not interfere with the program. With that, I would like to introduce you to Linda Schwimmer, President and CEO of the Quality Institute. Linda.
Thank you, Amanda, and thank you, National Quality Forum. I really appreciate the opportunity to be here with you all this afternoon. I've had the opportunity to see a lot of the NQF webinars throughout the past 16 months, and I think that this one fits nicely into the cadence of those webinars, as it's really an action plan for emerging from COVID, which hopefully we are doing now. We seem to be doing that now for the most part. And so we're excited to share our work with you today. And just a little bit about the Quality Institute. Thank you. The Quality Institute has been a member of NQF since 2003. So a very loyal member and an active member. Some of my colleagues have served on various NQF committees and boards. I had the honor of serving on NQF's board, as well as chairing its Consensus Standards Approval Committee, or CSAC. And I currently serve on its Geriatric and Palliative Care Committee, and was just recently appointed to co-chair the National Quality Forum's action team on virtual healthcare. And I want to just share something about the action team, because I really view the work that the Quality Institute did on this action plan for emerging from COVID as very similar to the NQF action team work. So if you're familiar with that work, you can think of this work in the same context, and certainly something that your organizations can do with others, either within your own state or at a regional or national level. Next slide. So a little bit about the Quality Institute. We are a multi-stakeholder not-for-profit. We're focused on improving the safety, quality, and affordability of healthcare for everyone. We're a membership organization, so we have all of the stakeholders of healthcare in our membership, and together we work to create a world where all people receive safe, equitable, and affordable healthcare to live their healthiest lives. So I'm sure all of that sounds quite familiar to many of you in terms of what you're trying to achieve. And like the National Quality Forum, we bring people together to build consensus, to really work through ideas. We ask people to leave their hat at the door, so to speak, and to think about improving the system overall, because we do believe that if we're improving the system overall together, we'll be able to achieve our vision. Next slide. And so with that in mind, at I guess it was early March of 2020, as you all know, the New Jersey, New York region was one of the early regions to see a surge of COVID. And as we were working with and checking in with the leadership of many of our members, we heard time and time again about the work that they were doing and the pivots and changes and creativity and just everything, stresses, everything they were going through. And we heard from them, this is going to be really important to capture a lot of these thoughts and lessons in our experience. And then at the exact same time, BioNJ, who was our partner in this work, was hearing from their members. They represent in New Jersey the life sciences industry. They were hearing from their members about a lot of the work that they were throwing themselves into collaboratively to keep clinical trials going, to develop new medications or further new medications to address COVID, to develop the vaccines in a rapid fashion, and other innovation that they were undertaking. And they actually approached us as we were thinking through how would we take on this sort of project. And like NQF's action plans, it was a timely topic. It was of great value to all of our members. We were not looking to do something that would be an exhaustive academic research-oriented project. We were really focused on how can we look at what's happening, look at best practices across the country, look at the needs, and then put forward actionable recommendations and to distinguish how one would take those various actions. How can we put that forward quickly to really help our state and others emerge from COVID? And so the result of about 6.5 to 7 months of pretty intensive work is this action plan and scorecard with 24 recommendations, which the three of us are going to be sharing with you at a high level today. And we really hope that you're able to take a deeper dive after this session. Next slide. So as I mentioned, we joined forces with BioNJ, and so similar to some of the National Quality Forum's work, BioNJ co-funded this initiative with us, gave us full editorial control, but was really a thought leader with us and an incredible partner. So we worked through this we developed the action plan by first reaching out to our membership, who were subject matter experts, and then with others who were involved in public health at the local, county, and state and national level. Next slide. So first, what we did was we identified the different subgroups or sectors of the healthcare industry. And we also identified as I mentioned, key public health officials. We conducted a number of interviews, probably over 20 qualitative interviews with these individuals to really get a sense of what the key issues and concerns were and what next steps we would need to focus on. The work groups specifically that we did these interviews from were healthcare facilities such as hospitals, federally qualified health centers, and of course, long-term care nursing homes, which we all know was really bearing the brunt of COVID's terrible outcomes. Providers, so providers that were not directly connected with these facilities, such as nurses, physicians, physical therapists, dentists. It was a really broad array when I say providers. And they were experiencing a lot of issues that I think were unique from the facilities, because New Jersey, like other places, had to immediately put a pause on everything other than emergency procedures. But that still meant that things like certain types of primary care, reproductive health, et cetera, continued. And so how that could continue in a safe way, and engagement with patients and supporting patients, telehealth, things like that were really important topics. Patient advocates and others that really focus on and provide a lot of social determinants of health were really active partners in this. Of course, the life sciences industry, which I mentioned, and then health plans and other payers and purchasers of healthcare. We engaged a lot of unions, large employers, representatives of small employers, as well as health plans that are engaged in both our commercial and Medicaid and Medicare Advantage markets. Next slide. And so after we conducted all of these interviews, we focused then on criteria for inclusion in the report. What we've seen in the past in our state, and I'm sure this is national, is that in prior, not prior pandemics, but in prior emergencies or disasters, whether it be 9/11 or Hurricane Sandy, a lot of focus was very specific to the emergency at hand. And so we really wanted to make sure that we were looking at broader, more long-lasting issues that would be transferable in the next emergency or healthcare emergency. We also wanted to make sure that what we were suggesting were actionable steps. And so we really wanted to focus on, is this something that can be done? And if so, who would do it? A lot of the recommendations discuss government, but we make it very clear, and we're doing that in our actions as well, that this isn't government alone. This is all of us moving these recommendations forward in various ways. And then we really wanted to make sure that we were including best practices, lessons learned, and we wanted to connect it to, as I said, future needs. The next slide. So now I want to dig into the specifics here, or at least at a somewhat higher level, but get a little more specific for you. After conducting all those interviews, doing our own research, and then looking through the criteria I just mentioned, 4 key areas really rose to the top, and they are creating and supporting a resilient and diverse healthcare workforce for the future. That was the first one. And I would say no matter which group we met with, and just to back up and clarify, our process, the way our process worked was we met with each stakeholder work group separately, and then we brought all 5 of them together, and then we did that multiple times. So it was really an iterative process with the intention of making sure that all 24 or however many, we didn't have a set number when we started, but really the intention in the process was to make sure that all of the recommendations were consensus recommendations. We did give participants the opportunity to opt out of having their name on the report, but none of them did. And they were very excited to have their names on report and provided us with lots of detail of spelling and title and exactly how they wanted to be listed, which was great, because moving forward, anyone who's picking up the ball and pushing forward on these recommendations can say that these are consensus recommendations that were worked on by this broad cross-sector stakeholder group. But where I was going with this is, no matter which of the groups I'm talking about, whether it was health plans or hospital systems or providers, the first topic that's listed here, the resilient and diverse healthcare workforce, and a real focus on the mental health and the resiliency of this workforce. This was across the board the topic that everybody discussed the most, and the one that they're the most concerned about. Our healthcare workforce has been through hell and back in the past year and a half. And there's a tremendous amount of burnout. There's also been economic stress on many sectors of them. And moving forward, really thinking about developing the healthcare workforce that we need for the future, that we need for what we know is a diverse population, particularly in a state like New Jersey. We've seen through just even the vaccine discussion that's still ongoing, how important it is to have a workforce that has a similar life experience and can relate directly and is trusted by the community that it serves. So really, we have recommendations in this category that go to helping us to create and support the workforce, the healthcare workforce of tomorrow that we're going to need. And tomorrow is like literally like almost tomorrow. So these are very front burner ideas for us. The second bucket of work focused on increasing support for alternative delivery of care and payment models, and really focusing that down, looking at, we discussed long-term care, the challenges of the nursing homes, and really how they need to be really addressed moving forward, different models of care within those facilities, but then also community-based care. Telehealth, really looking at what telehealth is how it can become part of the continuum of care, but really some of the issues we need to address, whether it's the digital divide or quality measures, or what telehealth is better at than others. I know George is going to talk a little bit about clinical trials and telehealth, so I'll let him do that. But then also alternative payment models and a real focus on primary care. We issued our report in April of this year, and right after that, the National Academy of Science and Medicine issued its report on primary care, and there's a lot of alignment between those two reports. So we really think of primary care as the necessary base for all of the alternative payment models of care, and think of it as a common good that we're going to need to advance public health. And so a lot of ideas are in the report and discussed. The third bucket of work is social determinants of health, and really we have specific recommendations that go to how a state and a healthcare the health system in general needs to be collecting and looking at data, and then using that data to further its policies to address social determinants of health, which will then really support better health. Because we know that 80% of really what makes a community healthy has nothing to do with direct provision of medical healthcare services. It's everything else from access to food, housing, financial equity, et cetera, that is really going to make a difference. And so those issues are discussed in the third section of the report. And finally, the fourth section of the report discusses revitalization and reorganizing of our public health infrastructure. New Jersey's probably similar to a lot of other parts of our country. We have a locally based public health infrastructure. Some of our local public health offices are quite strong and professional, and others are not. And what we saw was that whether they were well-trained and professional or not, very few of them were funded and staffed appropriately to deal with a pandemic like COVID. And so we have very specific recommendations for improving data systems, immunization registries, our medical reserve corps and connectivity of that volunteer corps to our licensing boards. And again, we need to invest in data technology changes. So there's a lot that is in that section. And then of course, the connectivity back of public health to primary care to build those trusted bonds within a community around public health campaigns. Next slide. So I know I said a mouthful, but I will just say that I'm excited that George Koutros, who I'll hand the baton to, is here to share an example of how one active participant in this work has been using it within his own organization and made a difference in the consensus building process in this report. And then my colleague, Tyla Minniear, will share how really this work and some of the 24 recommendations are already in action and being implemented. And we look forward to partnering with any of you who are interested in either furthering our work nationally or locally, or would just like advice on doing something similar to what we did in your own region. So thank you for your time today. And it's my honor to introduce George Koutros, who is the Director of State Government Relations for Sanofi US. Sanofi is a member of the Quality Institute and has been a great partner with us for many years. George has explained so many complex things about his industry to me over the years, and I really appreciate his partnership and participating today. So George, I'll turn it over to you.
Thank you, Linda. Thank you so much for those good words. I hope I did earn those good words. Good afternoon, everyone. My pleasure to be here today. And I do thank the Institute for the invitation to speak to everyone today. Once again, George Koutros. I am with our state government relations team here with Sanofi. With my role, I engage state legislators, state agencies, such as the Department of Health, and then also the policy folks at organizations like the Healthcare Quality Institute and other organizations throughout the states. Once again, my pleasure to be here today. I'm blessed with a long history within the biopharmaceutical industry with several different positions. Just quickly about Sanofi, sort of who we are. So Sanofi, we are a global, innovative, research-driven biopharmaceutical manufacturer. Our research and development, we focus on rare disease therapies, oncology, chronic diseases such as diabetes, as well as vaccines. Here in the US, we have about 12,000 employees, and we have manufacturing, distribution operations, commercial operations, all here within the US and spread out across the US. And then specifically for New Jersey, we have an operations headquarters as well as manufacturing in the state of New Jersey. And I just want to also mention quickly here for COVID-19 and Sanofi's engagement in terms of addressing the pandemic. As I mentioned, we have a vaccines unit. Currently, we are assisting Pfizer and J&J and Moderna in the manufacture of their COVID-19 vaccines. So our production facilities across the globe are engaged to provide and increase the global supply of those vaccines. As well as in terms of research, we have 2 targets within clinical trials right now for a COVID-19 vaccine. So certainly we work to continue to assist and hopefully develop further to bring a close to the pandemic and to benefit patients across the globe. Lastly, as Linda mentioned, Sanofi, we are a member of the Healthcare Quality Institute, as well as BioNJ, the life sciences trade group here within New Jersey. We are proud members, and certainly we wish to thank both organizations for their vision and leadership, representation, and action before, during, and as we move out of this pandemic. So from us to both of you, thank you so much. Next slide, Amanda. Okay, thank you, sorry. So again, pleased to be a member of the biopharmaceutical subcommittee for this report. Our engagement consisted of attending both subgroup meetings as well as the full group meetings. And just to review some of the highlights from a very robust discussion within this subcommittee group. First, in terms of employee safety, there was much best practice sharing and sharing and exchange of information on how to keep employees safe and what needs to be done. And certainly first and foremost for many of the members of this subcommittee, remote work was the top option and a pivot to ensure that employees can work from home and certainly stay safe, as well as be productive throughout the entire time. And guidelines and specifics around that were shared within the group. A quick term that we've all become familiar with, but even within our industry, essential employees. So especially regarding manufacturing and distribution, certainly a priority of the industry, a top priority is to ensure the supply of therapies for patients across the globe, no matter the situation. So supply chain issues, industrial affairs, how do you go about identifying certain folks as essential employees, and how do they move forward with that? That was a key topic. Who do you bring back into the office and how to bring them safely and appropriately into the office? Discussion around as well additional benefits for employees, and in this case revolving around behavioral health. So certainly everyone across the globe, an adjustment over a year ago, but it's certainly for folks, the well-being of the behavioral health and how they are adjusting, and the acquisition and dissemination of benefits from employers within the industry to their employees to ensure the well-being and emotional health of employees. And then lastly, even to the extent of how to work from home, and again, to certainly strike a balance between work and home life, work and family, and stay well at the entire time. So very much a topic of discussion, and certainly contribution to the full group as well. Of importance for the industry was the regulations within the state, within the country, across the globe. As you can imagine, just here in the US as a microcosm, executive orders from governors, executive orders from county executives, and multiply that across the globe, and certainly how to adjust and pivot. And some of the pain points for that as well. There was initially, and completely understandable, much dissonance between a state executive order or a county executive order, and the exchange of information, how to work through all of that. Again, with essential employees, documentation as they went to work, what is needed to prove to authorities if employees were stopped on their way to work, where they're going, and to prove they're actually essential workers. And at this point too, organizations like BioNJ and other groups very much stepped up to assist the industry and members address these types of issues. I think as you'll see within the report, the actionable items is recommendations to state government for the future, for a future unfortunate situation like the pandemic. Again, how that can happen, and governments issue regulations perhaps further in congruence with one another. Vaccine education, quite important. And again, many of the members of the subcommittee are involved either in vaccines or therapeutics for COVID-19. Certainly a topic, vaccine hesitancy, vaccine confidence. How do we address communities that are hesitant about the vaccine? And it's across the board, but certainly a focus on vulnerable communities and communities with a poor history of government intervention, industry, and certainly how to bridge the gap and provide the science of the clinical trials, the transparency of the clinical trials, and certainly the sound clinical trials for that as well. A focus on equity within the vaccine confidence and providing the vaccine. And then lastly, there was good discussion, pediatric vaccines. Again, for very understandable issues and reasons, pediatric vaccines dropped dramatically March through June, August of last year, and conversation around how can there be a catch-up in those pediatric vaccines to provide, to allow children to come back online in time for the vaccines, and much dissemination of resources from the CDC and others to help provide to providers to help them for that. I will say, for all the darkness of COVID-19, from an industry perspective, a bright spot is the immense collaboration, unprecedented collaboration among companies, competitors, to be frank, but all of us come together and the exchange of research information, the exchange and update of data, clinical data regarding vaccines or therapeutics, truly a bright spot, and shows and highlights the industry, all of the good that we do provide and we can do, and certainly we will provide going forward in the future. And so that's part of the reason we saw the proper execution of the clinical trials and the availability of vaccines, the FDA authorization for those, and certainly moving forward with therapeutics and otherwise. So certainly proud to see and say the industry stepped forward when it needed to exchange to aid the entire globe and population. And then lastly, telehealth. And so Linda mentioned this as well, but with clinical trials for decades now, patient engagement and interest in clinical trials has always been quite low, very low, and it's understandable. It's certainly the unknown, but it's also the structure of clinical trials where typically there are weekly in-person check-ins and checkups, whether it's vital signs and other diagnostic check-ins with clinical trials. Certainly extensive, time-intensive, labor-intensive, and I'm speaking from what I understand, a patient perspective from that. COVID has provided for a pivot for pharmaceutical research and in terms of telehealth and what required check-ins of a clinical trial can be conducted over the phone, through internet, remotely, as opposed to having patients come in. And certainly that was paramount in the beginning, certainly with in-person engagement halted for safety reasons, but it has allowed for the research industry to become more creative and to now hopefully, as we become more creative, remote engagement, that will lead to an increase in participation and with a special focus again upon health disparities and equity and the long overdue need for diversity within clinical trials and how do we achieve diversity within our clinical trials for the benefit of science and for the benefit of everyone. So pleased to see that, and certainly I see this pivot will become a permanent structure within clinical trials. Quickly, 2 items of feedback not listed on the slide here, but certainly pleased at the ability for Sanofi to respond back to the group, the full group, around telehealth, and certainly the importance, the need for telehealth to stay here, to be enhanced, to be offered continually, but also a focus on some of the services that cannot be provided directly through telehealth, and whether that is some of the vital signs or vaccinations or other types of services that need to be provided. So certainly a focus on the need for telehealth, and again, those services where it should be identified where a patient does need to see a provider, to come into the provider for proper treatment and care. And that leads me to the second item, which is a primary care model. Again, Linda had mentioned, and at Sanofi, we support the expansion of primary care, certainly with a primary care physician shortage here and anticipated ways to enhance that model, including vaccines. And I will mention there was a report from the Commonwealth Fund released on July 8th that speaks to just that topic of how to integrate COVID-19 vaccines into the primary care model. So certainly that's available as well. The one item here, very pleased again, Sanofi were able to provide a recommendation to the report, included in the report, about the establishment of a universal immunization registry here in New Jersey. And the purpose of this is certain that all immunizations are uploaded into the registry that currently exists within New Jersey. The vaccinations that are currently registered are providers who wish to remain eligible in the VFC program, and certainly to remain eligible, those providers update and upload the immunizations to the registry. The recommendation would expand this registry for all immunizations. And certainly the point of that is to provide greater data, key data to the Department of Health to help identify outbreaks that could occur, and certainly to implement quickly contact tracing and to hopefully get a handle on any type of outbreak of a certain preventable disease. A registry and a universal registry would help immensely with that, as well as just assist patients if for the need maybe to move their records or to be able to now house their personal health records and the ease of transition if need to move those records. So again, thank the task force and the group for the implementation and listening of that recommendation. And with that, I will now turn it over to Tyla Minniear, and Tyler with the Healthcare Quality Institute. And thank you once again. Thank you.
Thank you, George, and good afternoon, everyone. I'm Tyla Minniear, the Vice President of External Affairs at the Quality Institute, and I was fortunate enough to work closely with Linda and George, BioNJ, and a lot of our members to create this action plan. Next slide. So just a little bit about the dissemination of the plan. We released the report back in April of this year, and really at the start worked to make sure that it was read by a variety of local, state, and national stakeholders. Our dissemination plan included a press release, open press availability, blast emails to all of our members that were involved, policymakers, and social media campaigns. We also did a number of blogs in our newsletter that we hope that you'll have the time to check out with the report. We'll list our website at the end here. We also contacted a lot of different like-minded organizations from across the country to share the plan with, like National Quality Forum and others, and to share with their members and clients, et cetera. Next slide, please. And so now that we have widely disseminated the action plan, our focus is shifting to the actual work that needs to get done to accomplish many of these recommendations. The effort that we are putting forth is going to require broad stakeholder support and partnership, funding in some cases, and in some cases also legislative and regulatory action. So I'm going to go through just a couple of the recommendations here that share with you how they're already in progress and then what we hope to accomplish in the near future on them. Recommendations under that first action item that Linda mentioned, these resilient and diverse healthcare workforce for the future. Recommendations 1 and 2 that relate to publishing data on our healthcare workforce, and then also analyzing that data to help make recommendations for what that workforce should look like, how we should incentivize it. Those 2 recommendations, our goal is to work with not only the state legislature and the governor's office, who have made it clear that it's going to be a priority for them to make sure that we have a really strong healthcare workforce moving forward, but also the New Jersey Division of Consumer Affairs. They oversee the licensure process in New Jersey. We'd like to work with both of them and industry stakeholders to achieve these 2 particular recommendations. We've already created a funding proposal that we're actively talking to different funders about to achieve these recommendations. And we really, for these 2 in particular, need to do some additional research, more consensus building, and to create even more specific guidance around how the state could achieve these recommendations, given the system that we have in place right now. Recommendation number 4, that is actually being taken on by one of our members, the Rutgers Center for State Health Policy. They are leading a project that's currently funded by the Robert Wood Johnson Foundation, and it's called Evaluating the COVID-19 Emergency Reciprocity Licensure Program in New Jersey. And the purpose of the study is to evaluate the impact of New Jersey's emergency reciprocity licensure program. That was put in place last year to expand access to care and make sure that we were able to temporarily license more providers in New Jersey. But of course, a lot of change happened there. A lot of people came into the state to provide care, and we really need to analyze what the impact was. Where did people practice? Did they end up staying? So the Rutgers Center for State Health Policy is taking on that work and really looking into whether broader lessons can be learned about increasing access to care through easing those licensure recommendations. Next slide. And I think Linda mentioned this earlier, the New Jersey state budget was signed by Governor Murphy back on June 29th, and the budget included language around recommendations 14, 15, and 16 from the report. Recommendation 14, the state is now going to require disclosure and will annually report on the percentage of total medical expenditures that were spent on primary care services. The reporting applies to Medicaid and each of the state-funded employee and retiree plans. These data will help the state quantify how much it invests in primary care versus other healthcare spending. So having a strong primary care system, as Linda mentioned, helps to reduce inequities and supports overall population health and wellness. And as the state works to control those costs, it's important to really understand the overall healthcare spending that we have. And then on recommendation 15, the state, through several of its departments, are going to create a market scan of state-funded team-based primary care. And they are going to look into models that will best serve New Jersey in primary care across the state. As Linda mentioned, it's incredibly important to us and to a lot of our members that people have that trusted relationship with a primary care provider, and that really is the basis for better population health. And then recommendation 16, which was also included in the budget language, there will actually be funding for the Department of Health to work with other agencies and boards to establish and publicize best practices for local boards of health to actively engage with local primary care physicians and nurses to address public health at the local level and to further public health campaigns. In that work that we did to interview public health officials from across the state, we really found that those relationships were just starting to be built during the pandemic. So as George mentioned, with collaboration and a silver lining of the pandemic, really those relationships were critical during the pandemic. And we really want to build on that momentum and make sure that these relationships continue to flourish. And then lastly, on our last section of the report, revitalizing and reorganizing our public health infrastructure. The first recommendation there, 22, the Edward J. Blaustein School of Planning and Public Policy at Rutgers University is conducting an examination of local public health in New Jersey. They have also received support from the Robert Wood Johnson Foundation and are working very closely with the New Jersey Department of Health and also an organization called FACE. FACE is the Public Health Association's collaborative effort. That includes 6 different public health associations in New Jersey. And the project involves comparing New Jersey's public health capacity to other states, examining public health in New Jersey, developing case studies, and then also doing a statewide public opinion poll of public health in New Jersey. So we are really excited to see that some of our members and partners are already taking on this work. And in 2 of the cases that the Robert Wood Johnson Foundation is providing support for that. And then lastly, George already mentioned this particular recommendation, but establishing a universal immunization registry. This particular recommendation has already received really broad public support from a lot of different organizations. And from what we understand, the legislature, which will be reconvening in the fall, are going to look to take on that particular issue. So we're excited to see that as well. So for us, I think we're really at a point where we're continuing the dissemination of the action plan. So we'd love it if you would share this report with your members, clients, and your networks. And then also looking for partners and friends on these recommendations to achieve them. So for us, it's there's no pride of ownership here. We really want to support this work being done. So if there's interest in any of these recommendations, we would love it if folks would reach out to us and let us know if you'd like to partner with us on these recommendations here in New Jersey. But then, as Linda mentioned, also, if you'd like to achieve them in your own regions across the country, we would love to talk to folks about how we accomplished this. Next slide. And so here's our contact information, our website where you the report, the shortened link there, and then also the blogs that I mentioned on the action plan. So Amanda, I think I'm going to send it back to you for questions.
All right, thank you all so much for this information. We have reached the question and answer portion of our webinar. So please use the Q&A box at the bottom or top or side of your screen, however you have it oriented, and our presenters will address the questions as they come in. And And while we're waiting for questions to come in, you all mentioned willing and being interested in partnering with other organizations in different regions across the country. Do you have an ideal way of how that would look, or what things are cross applicable that people should definitely, if they were looking to apply this somewhere else, would want to be interested in?
So I'll start, Amanda. Thanks for that. Thanks for that question. I think that let me start with telehealth, or virtual health, as NQF calls it, because I think that's a natural, because you can really be anywhere. Each state probably had its own experience, because state by state, your payment regulations or your site of care regulations or laws might be a little bit different. I think that there's so much that we've probably learned in a brief period of time, and so much more to learn looking at data. And so that's an area where we would love to hear from other organizations to learn more about what you're doing, and we can certainly share our experience and what we're doing. But I think that's one that's quite transferable. I don't know, George or Tyla, if you have other thoughts on that or other aspects of the report.
Yeah, I'm happy to jump in. I think for me, two of the recommendations that I mentioned, 1 and 2 in the report, have some research that we did on a best practice model out of Oregon. So we contacted those folks after the fact and are actively talking to them about how that model for improving the healthcare workforce in Oregon is working there, and how it could be applicable to New Jersey. So for us, we really like finding great models that exist elsewhere. And if there are those out there, or if we have some here in New Jersey, we love to work with, again, like-minded organizations that we can share those best practices and really learn from one another in what's an unprecedented time in healthcare.
Great. Go ahead, George.
I'm sorry, just real quick, also Linda as well. So those members of the task force that are also members of BioNJ came together not too long ago to talk about priorities and certainly how the organization within New Jersey would move forward. And it was issues of telehealth, as well as clinical trial diversity and this registry, the intersection of interests of all those members. Those are the 3 topics to work together on, and also through BioNJ. And I would say also too, Linda, I think the uniqueness of this report, this task force, we were convening while still in the middle of the pandemic. So we were exchanging real-time experiences and learnings and takeaways. So as opposed to this being a debrief or an after action review, we were certainly in the midst of all this and coming together and looking to plan how can we best respond to, unfortunately, the next pandemic. So I think this was unique and certainly helpful in real time for all the stakeholders involved.
Great, thank you all. We do have a question from the audience. Did you also have a chance to engage emergency medical technicians for the development of your action plan?
I can take that one. For us, we had a great variety of medical professionals that participated in the work group. I don't know if any of them were alternatively also an EMT, but for us, I think we have a great opportunity now that the action plan has been released to work on a number of these recommendations with an even broader group of stakeholders. So as I mentioned, those first 2 on workforce health, it would be our goal to create a consensus, a similar multi-stakeholder group of professionals in New Jersey to help put those recommendations together. So it would be our intention to create another work group that met a few times to actually put forth those recommendations. And we would need an even broader representation of medical professionals to be able to do that. So I think there are plenty of opportunities to continue to get involved. We'd love to hear from EMTs in New Jersey.
All right, if there are any other questions for the audience, we have just a few minutes left. I don't want to cut anyone off. Um, but in developing the report and engaging your stakeholders, were there any issues that came as a surprise that came out in like your beginning stages where you were just gathering as much information as possible?
Yeah, it's funny that you asked that question. That's what the reporters asked at the press conference that we did too. And I feel like we interviewed so many people and did such we really heard from everyone on this that I would say the process itself was enlightening. So that maybe if there was a surprise, it was that organizations that had been fierce competitors, and New Jersey is a very competitive place, really came together and worked together side by side in the trenches, sharing equipment, sharing PPE, sharing best practices, sharing staff. I mean, they really came together. And as Tyla mentioned too, new relationships were formed between government, public health, and the healthcare system. And those are the things that we want to leverage moving forward, this collaborative spirit, the relationships that were built, the newfound awareness of what each entity does and its needs. I don't think that it was a surprise, but certainly the haves and have-nots, the disparities were highlighted. And I think that moving forward, particularly with all of the federal funding that we have, we all have to hold each other accountable and make sure that we really address those inequities, that we invest in public health in a sustainable way, and that we really think about the social determinants of health that really made this pandemic so much worse for certain communities. I don't know, Tyler, George, if you have anything.
Yeah, one other surprise for us, I think, was as Linda mentioned, the underfunding of public health. We worked with Trust for America's Health, a national organization that does great work on how public health works and how it's funded. And according to their last report, New Jersey ranks 50th for public health funding. So for us in the healthcare world, just making sure that public health is a priority, having public health at the table, having these discussions and making them a part of the healthcare system. I think it was really an eye opener for us and really became a critical mission for us post action plan.
I'll just add as well, I think for me, the theme is certainly COVID pivots to permanent constructs. And so to Tyler's point about the underfunding of public health, now that we see it and it's been addressed, it's identified, how do we ensure that it doesn't happen again? Again, within the industry, the complete collaboration and exchange of data and research and material to move forward, to move us out of this pandemic, we must ensure that stays in place, right? And it's proper, and we move forward to benefit the entire globe. There was good communication among stakeholders and local government, state government, as we all move through the early stage of the pandemic. There was a collaborative spirit, as Linda mentioned, that we need to work together to get through this. How do we ensure that remains, right? And there's a lot of politics, and absolutely in New Jersey, and everyone is proud. But again, we've learned that we need to work together and be accountable to each other. And then lastly, certainly the most important pivot that needs to become a permanent focus is the health disparities and a focus on equity. And again, we all move together as one. So how do we help one another to get to a good place. So we saw that through this microcosm of the task force and open collaboration within subcommittees and then the full group, and certainly for the Healthcare Quality Institute to make it happen and put it all together. We need to catch this lightning in a bottle and that collaborative spirit and keep it moving forward.
Thank you for that. I think we have just one last question. Are there any plans in the long term to build on this action plan so that it can address not just pandemics, but other types of public health emergencies, like those similar to Hurricane Sandy or disasters driven by climate change?
Yes, no, I love that question. Thank you. Thank you for it. And that's exactly what this report is about and what we're trying to do. I'll take a couple examples that are in the report. The focus on primary care and connectivity, having everyone connected to a primary care practice, and then the focus on connecting primary care and also to public health, and then also just furthering public health, strengthening public health. If we can have more, local public health does market scans and they provide services at the very micro local level. So they often tend to know, particularly if they've gone through the process of doing engagement and interviewing, they tend to know who in their community has special needs, who might have equipment that they have insulin or they have a ventilator and they have equipment that needs to have access to electricity or a generator backup. They have a lot of that information, but to date, it's been somewhat siloed and not connected to the broader healthcare system. But as these systems become more engaged, familiar with each other, better funded and working together, having that sort of seamless relationship and handoff would be really important in something like a environmental disaster where we needed to know that we needed to immediately help the people that were the most vulnerable in those sorts of situations. And so that's really at the essence of this report, is it's building up the systems, the relationships, the technology, the data sharing. I mean, those were the weaknesses that we saw throughout this process. And so I think those are embedded in all 4 sections of the report, and one of the reasons why a lot of these recommendations really will be transferable across the calamities to come. I don't mean to sound like, like Calamity Jane, but we know all these things are going to come in one shape or another. And so the more we can do to put these, supports in place across systems, the better off we'll be. And that hopefully that comes across in the report. And those are the types of things that we're looking forward on working on with all of our partners.
I'll just elaborate on that. I think when we spoke to some of our public health partners, they made the point over and over again that if we continue to only pay attention to public health during an emergency situation, during the next emergency, they're not going to be properly funded, properly staffed, and ready to go to help. So we have to really pay attention and make sure that we're doing what we need to do during non-emergent times to keep public health strong.
Great. Thank you all for engaging with your questions. Thank you, Linda, George, and Tyla, for sharing your experiences, the depth and breadth of time and effort that went into developing this report and moving it forward and making it sustainable. We hope that the information that was shared today will be informative and helpful to you all as you are formulating your own plans within your organizations. If there are any other topics on this series that you would like to see or need additional information shared by Tyla in the group and Linda and George, please reach out to us. We are going to post this webinar on our Member Connect platform and also make it available to to the public through our YouTube channel. Please be on the lookout for a survey right after this program. If you could just take a quick few moments to give us your feedback, we would appreciate it. And next week, just a quick plug for the NQF Annual Conference taking place next week, July 20th through the 22nd. There's a virtual conference. Please be sure to join us there. And more information about that is available on our website. With that, this concludes our program. On behalf of everyone at NQF, we thank you for your attendance and wish you all good health.